Hi there! Have you ever walked into your kitchen and forgotten why you went there in the first place? I mean, maybe you were about to do something important, or perhaps you just needed an excuse to raid the fridge again. Or maybe you're struggling to find words that used to come easily. Well, that's exactly how one of my patients, Sarah, felt. She was 55 years old and started forgetting appointments, while her keys kept on playing hide and seek with her. She thought she was developing early dementia, but the real culprit here was lurking in her medicine cabinet. And if this sounds a little bit like you, take a breath, you're not alone. And I promise you, it's not just the number of candles piling up on your birthday cake. I'm Dr. Ace, and I made this video after noticing that most people don't realize how harmful some common, even over-the-counter medications can be to our minds. And the good news, most of the time this memory loss is reversible. But before we fix this, we need to know what's going on up here, right? So stick around as we dive into 7 medications that could be putting your brain on snooze mode. And trust me, you don't want to miss number 7 because I guarantee you that you're either using it right now or you know someone that already uses it. Also, I know we've just met, but consider subscribing and giving a like to help in spreading this information to those that really need it. I thank you in advance. So now let's expose these undercover imposters. Number 1. Ever had back pain or a stiff neck and reached for a muscle relaxant like Cyclobenzaprine? Well, it just so happens that Sarah also had back pain and hers had become chronic due to years of neglect. The only way she found some relief was taking muscle relaxants, one called Flexedril, which is just a fancy name for Cyclobenzaprine. But here's the problem. While it did ease her discomfort, it also silently was robbing her of her sharpness and memory. Now you might be thinking, how could that be? Well, let me explain why. You see, cyclobenzaprine works by blocking a neurotransmitter called acetylcholine. This chemical is like the body's messenger, telling your muscles when to contract. When you block acetylcholine, your muscles relax, easing pain and tension. It sounds like a relief, right? And for Sarah's back pain, it certainly was. But here is where it gets tricky. Acetylcholine doesn't just help your muscles, no, it's also a neurotransmitter that is fundamental for your brain. It acts like a key unlocking in your brain the doors to memory and learning. When medications block acetylcholine to relax your muscle, they also reduce its availability in your brain. Suddenly, it's not just about your muscles being relaxed, but your brain also becomes a sluggish mess. In Sarah's case, while the muscle relaxant took away her physical suffering, it delivered a different kind of pain, causing her to forget appointments, lose her train of thoughts, and even feel like her mind was rusting away. Her pain was now psychological and accompanied with the fear of losing her mind for good. Now, imagine this happening to you or someone you love without even knowing it. Medications have silent side effects we don't always think about. That's exactly why I made this video, to help you out the same way I helped Sarah get her life back on track. Not just regain her memory, but also her confidence. So don't forget, if this sounds like someone you know, your mom, your friend, or even yourself, share this video so we can help more people avoid these hidden pitfalls. And with no further delays, let's continue. Number 2. You've probably heard of proton pump inhibitors, right? Those are the go-to meds like omeprazole and esomeprazole, the saviors of acid reflux and ulcers. But hold up, what if something designed to help your gut was actually secretly sabotaging your brain? Meet John. John was a hard-working guy like many of us, constantly juggling deadlines, projects, and the stress of a demanding job. No matter what he did, he never seemed enough. He felt like he was a failure, and he lived carrying anxiety around on his shoulders like a boulder. To make it all worse, he had been having gastric problems for as long as he could remember. Constant heartburn, indigestion, and that gnawing feeling in his stomach that wouldn't go away. His doctor never looked deeper into the cause of these problems and simply prescribed him proton pump inhibitors to manage his gastric symptoms. For over a decade, John was pumping those pills like they were Tic Tacs, thinking they were helping, but what he didn't know was that while they were cooling his stomach down, they were also quietly eroding his memory. Slowly, he began to notice small changes, forgetting keys, appointments, and finally struggling to focus at work. It was frustrating, and neither him nor his doctor could pinpoint the cause. That's when John came to me. After looking into his case, I realized not only that his chronic stress was the root cause for his stomach issues, but also that the long-term use of PPIs was contributing to his cognitive decline. Since these medications can cross the blood-brain barrier and interfere with acetylcholine production in our brain. And now that you already know the importance of acetylcholine, we just talked about it, it shouldn't come as a surprise that without enough of it, neurons in the brain struggle to communicate and can't form new memories. What will surprise you though is that John didn't even need PPIs to begin with. That's because stress, not acid overproduction, was the underlying cause, wreaking havoc on his digestive system. You see, when we are stressed, our body undergoes a series of changes. Cortisol levels spike, the brain-gut axis is disrupted. Yes, the brain does communicate with the gut, and due to these changes, our stomach starts producing excess acid, even when there isn't an increase of food intake. This leads to the symptoms that mimic acid reflux or peptic ulcers, but the true culprit here is the nervous system overstimulating the digestive organs. But here's the good news. Once we removed the PPIs and started treating his chronic stress, John's life began to turn around. Not only did we address the stress that was carving away at his stomach, but his memory improved too. Now John is sharper than ever before at his job, and his job that used to be a daily chore became easier and even enjoyable. Turns out that once he was able to focus again, he was actually really good at what he did for a living. Who could have imagined that those pills were holding him back so much? Now imagine this could be you, slowly losing track of things, not knowing that a simple medication is ruining you. So don't risk your future, stay subscribed, and stick to the end of this video when I will review the 3 worst memory offenders. And let's go to the next item. Item number 3. Imagine this, your grandma who you adore started taking a medication called Oxybutynin to help manage her overreactive bladder. Now, she's telling you the same story about the neighbor's cat for the 3rd time today. And while it was adorable the first couple of times, by round 3, you're wondering if it's just her being forgetful or could the medication be contributing. Well, here's something most people don't know. The medication that helps keep bladder spasms in check can block your brain's memory department. Yes, Oxybutynin works by blocking acetylcholine, which you already know by now that your brain needs to stay sharp, right? When you block it, it's like hitting the Wi-Fi off switch in your brain. Things slow down, get glitchy, and enter into a perpetual buffering. The Journal of Urology, yes, it's a real thing that exists, recently shared a study that followed over 28,000 elderly patients, and the findings were a wake-up call. Long-term use of medications like Oxybutynin was linked to a 48% higher chance of developing dementia. Now, I don't know about you, but a nearly 50% increase in the risk has me concerned. That's like flipping a coin and betting your mind on it. Heads, you're fine. Tails, not so much. So what's the plan? You can't just stop giving grandma her meds, right? Trust me, nobody wants a surprise dash to the bathroom. The key here is balancing bladder control with brain health. Therefore, it's important to choose with care when to use alternatives like beta-3 agonists, neuromodulation, and even Botox for the bladder. Yes, Botox. I surprised you, right? That's why I share this info, not just to fix one problem, but to help you avoid future ones. Now, let's keep going. Number 4. Imagine trying to think clearly, but it feels like your thoughts are moving through molasses. That's what anticonvulsant medications like valproic acid and topiramate can do to you. While they are excellent for controlling seizures and migraines, they should be reserved for patients who genuinely need them, not just thrown around like candy. This brings me to one of my patients. Let's call her Emily. Emily had been prescribed topiramate by another doctor to help with her insomnia. Yes, you heard it right. An anticonvulsant typically used to treat epilepsy was being used to treat simple sleep issues. At first, Emily was hopeful that this might be the solution to her sleepless nights. But after just a few weeks on the medication, she started noticing a different problem. She described it like this. It felt like my brain was stuck in slow motion. I would walk into a room and forget why I was there. I couldn't keep up with conversations or even remember what I did earlier in the day. Now, her insomnia might have been getting better, but her mind was paying a heavy price. Emily felt like she was losing control of her own thoughts. When she came to me, it was clear that Topiramate wasn't the right fit for her. Together, we devised a more appropriate treatment plan that didn't rely on heavy medications. We focused on improving her sleep hygiene, managing her stress, and using safer, non-addictive alternatives. If you want a video about those, go ahead and subscribe. Within weeks, she felt like she was herself again. She felt sharp, she felt alert, and she felt finally able to get a good night's sleep without sacrificing her mental clarity. Emily's story is a reminder that these medications can be lifesavers for some, while for others they can be as catastrophic as using a flamethrower to light a candle. If you got a similar story, drop it in the comments below. Now let's go into the top 3 memory killers, the heavy hitters, the top 3 medications that could be wreaking havoc on your memory. The first one is our number 5 medication, right? It is opioid painkillers. Now let's talk about the opioids like morphines, oxycodone, and tramadol, which are powerful tools in managing severe chronic pain, but they come with a significant risk, especially when used long term. I had a patient, let's call him Steven. Steven was an older gentleman who had been dealing with chronic back pain for years. Like many, his doctor had prescribed opioids to manage the pain. While it initially seemed like a miracle, allowing him to move his life on without daily suffering and discomfort, over time something changed. Steven noticed he was becoming forgetful, losing track of conversations, and sometimes struggling to recall even simpler things, like to pick up his grandkids at school. He chalked it up to getting older, but it became clear that something was going on deeper into his mind. It wasn't until Steven came to me that we realized that his prolonged opioid usage was contributing to his cognitive decline. This isn't just a speculation. Studies have shown that long-term use of opioids, particularly beyond 90 days, can and will significantly increase the risk of dementia, especially Alzheimer's. These medications, while effective for short-term pain relief, can disrupt the brain's neurotransmitters, affecting areas like the hippocampus, which are critical for memory and learning. So, what was the solution? We didn't just stop the opioids cold turkey, okay? This is never the right approach. Instead, we developed a comprehensive pain management plan that gradually reduced Steven's reliance on opioids. Over time, Steven's cognitive function improved and his back pain became more manageable without the mental fog that weighted him down for so long. The key takeaway here is that while opioids might be necessary in certain cases, they shouldn't be the first or only line of defense. There are safer ways to manage chronic pain, and if you want videos about them, stay subscribed, alright? Number 6. Now imagine this scenario. You are tossing and turning, unable to sleep, and your doctor prescribes Zolpidem to help you get some much needed rest. You start taking it and first everything seems great, but over time you notice little things, misplacing items more often, forgetting important dates, and struggling to focus on daily tasks. Sounds familiar? This is the reality of many people worldwide, and avoiding it was a big motivation in making this video. I want you to know that Zolpidem is known to affect the brain's GABA receptors, which play a critical role in calming the brain activity to promote sleep. And that is one of the main reasons behind how it does its calming magic. But here's the catch. Studies have shown that long-term usage of Zolpidem will impact cognitive function. So it's important to avoid prolonged use, especially in the elderly, since it will lead to memory loss and an increased risk of dementia. That is a nightmare you do not want to have. Number 7. And speaking of nightmare, if you thought Zolpidem was bad, be prepared to meet its older and meaner sibling. It's not just one medication, it's a whole class known as Benzodiazepines. These drugs, often prescribed for anxiety, insomnia, and even muscle spasms, come with significant side effects that go far beyond feeling a bit drowsy. If Zolpidem is a short-term fog, benzodiazepines are a long, dark cloud that covers your brain. Imagine feeling anxious and reaching for relief, not knowing that each dose might be chipping away your ability to remember precious moments. That's what happened to Steve, a retiree who had been taking benzodiazepines for years to manage his anxiety. At first, the medication seemed like a lifeline. It helped calm his nerves and gave him the peace of mind that he was looking for, but slowly he noticed something heartbreaking. Steve started forgetting his grandchildren's names. Simple conversations became challenging, and family gatherings that once brought him joy began to feel like a confusing blur. This isn't just an isolated story. Long-term use of benzodiazepine drugs like lorazepam, diazepam, and clonazepam have been linked to serious cognitive declines, including an increased risk of dementia and Alzheimer's. Studies show that these medications impair memory, slow down thinking, and affect your brain's ability to process tasks. What's worse, even after discontinuing them, many patients never fully recover their cognitive abilities. For Steve, the turning point came when he realized his memory lapses weren't just a part of aging. With professional guidance, Steve gradually reduced his dependence on benzodiazepines, replacing them with a combination of cognitive behavioral therapy, mindfulness techniques, and other non-addictive treatments. Over time, he began to regain his mental sharpness, and most importantly, he found joy in his memories again, those precious little moments with his grandchildren that had started to slip away. So, if you are ready to take control of your health, hit that subscribe button and let's do this together. Also, feel free to like and share your experiences in the comments below. Have you noticed memory changes related to medications? Your story could help someone else. And if you know someone relying on benzos or any of the medications we have covered in this video, share this video with them. You might just help them find a better path forward.